Last year, I stood over a 67-year-old man on my operating table, and what I saw inside his chest stopped me cold. His arteries looked like concrete pipes, literal concrete. This man was on four blood pressure medications, and his pressure was still dangerously, terrifyingly high. He wasn't lazy. He wasn't in denial. He was doing every single thing his doctors told him to do, and it wasn't enough. My name is Luisa Hart. I'm a cardiac surgeon. I have spent 3 decades holding human hearts in my hands, repairing damage that should never have happened, and asking myself the same haunting question every single time. How did it get this far? Today I'm going to answer that question, and I promise you, what I'm about to share is going to change the way you think about your kitchen, your pantry, and what you put on your plate starting tonight. Because here's the truth that nobody tells you. The answer was sitting in that man's kitchen the entire time. 5 things. No new prescriptions, no side effects, no exotic supplements, just food. Working the way food was always meant to work. Stay with me, because by the end of this, you'll know exactly what to do. Tonight, not next week, tonight. Let me explain something that most doctors simply don't have time to explain during a 15-minute appointment. After the age of 60, your blood pressure doesn't just rise because of stress or salt. Something far deeper is happening. Something happening right now, inside your arteries, while you go about your day completely unaware. Picture a garden hose, young, flexible, able to stretch and absorb pressure and handle whatever flow you throw at it. That's what your blood vessels are supposed to be. But as the years pass, the walls of those vessels begin to stiffen. They lose their elasticity. They become rigid. And a rigid hose cannot handle the same pressure a flexible one can. That's when your heart starts working harder and harder and harder. Now here's the part that genuinely haunts me after 30 years in the operating room. The reason those vessels stiffen, the reason so many people over 60 find themselves on multiple medications and still struggling, is inflammation. Chronic, silent, slow-burning inflammation inside the walls of your blood vessels. You don't feel it. There's no obvious symptom. No alarm goes off. But day after day, year after year, it quietly stiffens and narrows those vessels until your heart is fighting just to push blood through. And what fuels that inflammation? What you eat. 3 times a day, every single day, you are either fighting that inflammation or feeding it. Every meal is a vote, a decision your body makes about your blood pressure. Most people have no idea this is happening, and that is exactly why I'm here. This is not about replacing your medication. I need to be absolutely clear about that. This is about giving your body 5 powerful tools that work alongside whatever your doctor has prescribed. Tools that I have seen in real patients in real life make a dramatic difference, sometimes within days. Are you ready? Let's go. Here is the first thing, and I want you to listen carefully because it sounds almost insultingly simple. And that is exactly why most people dismiss it and never experience what it can do. Tonight, when you sit down for dinner, eat your vegetables first, before anything else on that plate, before the bread, before the rice, before the potatoes, before whatever else is on that table. Vegetables first, every meal, every single time. Now I hear you. That's the big secret from a cardiac surgeon. Hear me out. When you eat vegetables first, the fiber in those vegetables forms a physical mesh inside your stomach, a barrier. And what that barrier does is remarkable. It dramatically slows down how quickly sugar from the rest of your meal enters your bloodstream. Why does that matter for blood pressure? Because every time your blood sugar spikes sharply after a meal, your body releases a surge of insulin. And that insulin surge, right there at your dinner table, causes your blood vessels to constrict, to tighten. Your pressure goes up, and you have absolutely no idea it's happening. I have had patients who changed nothing else. Same food, same portions, same medications, just the order. Vegetables first, protein second, carbohydrates last. And their post-meal blood pressure readings dropped noticeably within 2 weeks. One of my patients, a retired school teacher, 71 years old, called me and said, "Luisa, this is the easiest thing I have ever done for my health." She was not wrong. So tonight, before the rice, before the bread, before anything else, finish those vegetables first. Every bite counts. Now let's talk about something that might be sitting in your pantry right now, completely ignored, doing absolutely nothing for you. Apple cider vinegar. 1 to 2 tablespoons, a glass of water, every meal. I know, I can hear the skepticism. And honestly, good. Skepticism is healthy. So let me show you exactly why this works, because there is real peer-reviewed science behind it, and it's genuinely exciting. The active compound in apple cider vinegar is acetic acid. And acetic acid does 2 specific things that matter enormously for your blood pressure. First, it improves insulin sensitivity. Remember those post-meal blood sugar spikes that constrict your vessels? Acetic acid blunts that spike. It helps your cells respond to insulin more efficiently, so your body doesn't have to flood your system with it. Less insulin, less constriction, lower pressure. Second, and this is the part that made me sit up straight the first time I read the research, acetic acid stimulates the production of nitric oxide in your blood vessel walls. Nitric oxide is your body's natural vasodilator. It tells your arteries to relax, to open up, to breathe. It is essentially doing what an entire class of expensive blood pressure medications tries to do, naturally, for about $3 a bottle. One important note, never drink it straight. Always dilute it in at least 8 ounces of water. Undiluted vinegar can damage your tooth enamel and irritate your esophagus. Use a straw if you can. And if you have a history of stomach ulcers or acid reflux, talk to your doctor before you start. But for most people over 60, this is one of the simplest, safest additions you can make. 1 glass with breakfast, 1 with lunch, 1 with dinner. Give it 3 weeks, then check your numbers. Have you ever tried apple cider vinegar? Tell me in the comments. I want to know what you've heard, what you've tried, what surprised you. Let me ask you something personal. Do you check your blood pressure in the morning? Most people do. But here's what almost nobody talks about, and what I consider one of the most dangerous blind spots in managing blood pressure after 60. What is happening to your pressure while you sleep? For many people, blood pressure should drop during the night. Your heart should get a rest. Your vessels should decompress. But in a condition called nocturnal hypertension, which is far more common than most people realize, pressure stays dangerously elevated or actually spikes while you're lying there completely unaware. While you sleep, your heart is working overtime, your arteries are under stress, and you wake up the next morning feeling inexplicably exhausted, wondering why. Here's what makes this condition so insidious. Your regular daytime readings won't catch it. You can have perfectly acceptable morning numbers and still have a serious problem happening every single night. It is linked to a significantly higher risk of stroke and heart attack, and most people have never even heard of it. So what do walnuts have to do with any of this? Quite a lot, actually. About 30 grams, roughly 14 walnut halves, eaten 30 minutes before bed, has been shown in multiple studies to meaningfully reduce nighttime blood pressure. Here's why. Walnuts are one of the richest plant sources of alpha-linolenic acid, a plant-based omega-3 fatty acid. They also contain melatonin and a compound called L-arginine. Together, these work to relax blood vessel walls, reduce vascular inflammation, and support that natural nighttime pressure drop your cardiovascular system is supposed to make. Think of it as a gentle message to your heart. It's time to rest. Stand down. 30 grams, 14 halves, 30 minutes before bed. Write that down. It's one of the simplest things I recommend, and one of the most consistently effective things I've seen work in real patients. Now I want to tell you about a flower. A deep jewel red flower used in traditional medicine across Africa, Latin America, and the Middle East for centuries, that modern cardiology has finally, at long last, caught up with. Hibiscus tea, 3 cups a day. If you've never heard of hibiscus tea, you might know it as sorrel or carcade or simply red tea. It has a tart cranberry-like flavor, and it is remarkably, almost shockingly powerful. Here's the science. Hibiscus flowers contain compounds called anthocyanins and organic acids, specifically hibiscus acid. And these compounds act on your blood vessels in a way that is strikingly similar to a class of prescription medications called ACE inhibitors. You may have heard of ACE inhibitors. They're among the most commonly prescribed blood pressure drugs in the world. What they do is block an enzyme that causes your blood vessels to constrict. Hibiscus does the same thing, naturally. And without the dry, persistent cough that drives so many of my patients absolutely crazy as a side effect. A study published in the Journal of Nutrition found that drinking hibiscus tea daily reduced systolic blood pressure by an average of 7 points in adults with mildly elevated pressure. 7 points. That is clinically significant. That is the kind of result that makes cardiologists lean forward in their chairs. 3 cups a day, hot or cold, no sugar or as little as possible, because sugar works directly against everything we are trying to do here. A small spoon of honey if you absolutely need it. That's fine. One important caution. If you are already taking an ACE inhibitor medication, please speak to your doctor before adding hibiscus tea to your daily routine. Combining a natural ACE inhibitor with a pharmaceutical one can push your pressure too low. We want balance, not overcorrection. But for most people, this is a beautiful, genuinely pleasurable daily habit. A warm cup of red tea in the morning, one in the afternoon, one in the evening. Your arteries will notice. What's your tea of choice right now? Tell me in the comments. I'm genuinely curious how many of you are already helping your heart without even realizing it. I want you to do something after this video. Walk to your kitchen, open your cupboard, and look at what oils you have in there. Because what I'm about to tell you might be the single most important thing in this entire video. And it is also, I say this without exaggeration, the thing that certain food manufacturers have spent enormous amounts of money making sure you don't fully understand. Most of the cooking oils that line supermarket shelves, canola oil, soybean oil, sunflower oil, corn oil, are extremely high in omega-6 fatty acids. Now, omega-6 isn't inherently evil. Your body needs some of it. The devastating problem is the ratio. For most of human history, people consumed roughly equal amounts of omega-3 and omega-6 fatty acids. Today, the average person consumes anywhere from 15 to 20 times more omega-6 than omega-3. 15 to 20 times. And that extreme imbalance drives something that every cardiologist and cardiac surgeon dreads: chronic systemic inflammation. That slow-burning inflammation in your blood vessel walls, the kind that stiffens your arteries year after year, the kind that turns flexible vessels into concrete pipes. Excess omega-6 from refined oils is one of the primary fuels feeding that fire. Every time you cook with canola or soybean oil, you are pouring gasoline on cardiovascular inflammation. And here's what makes it even worse. These oils are unstable at high heat. When you heat them to cooking temperature, they oxidize. They break down into toxic compounds called aldehydes that are directly damaging to blood vessel walls. You can't see it, your food doesn't taste different, but the damage accumulates with every single meal. So what should you use instead? 2 things. Extra virgin olive oil, for everything that doesn't require very high heat. Salad dressings, light sautéing, drizzling over vegetables. Extra virgin olive oil is rich in oleocanthal, a powerful natural anti-inflammatory compound, and in monounsaturated fats that actively support healthy blood vessel function. Decades of research back this up without any serious scientific debate. And for high heat cooking, real butter. Yes, I said butter, not margarine. Margarine is made from the exact same problematic vegetable oils we are trying to eliminate. Real traditional butter, from grass-fed cows if you can find it. Used in reasonable amounts, it is a dramatically better choice for your cardiovascular system than the refined seed oils most people cook with every single day. I know this goes against what many of you were told 20 or 30 years ago. Butter is bad. Use vegetable oil. I heard that too. We all did. But the science has moved on. And as a cardiac surgeon who has seen inside thousands of human chests, the evidence now points clearly, unmistakably, in a different direction. Check your cupboard tonight. If you have canola or soybean oil, you don't have to throw it away this second. Just stop buying it when it runs out. Replace it with extra virgin olive oil. That one change alone, sustained over 3 to 6 months, can make a measurable difference in your inflammatory markers and your blood pressure. I want to stop here for a moment because something important needs to be said. You've just heard 5 things. Eat vegetables first, apple cider vinegar with meals, walnuts before bed, hibiscus tea 3 times a day, replace the wrong oils. And I already know what some of you are thinking. This sounds too simple. If it really worked, my doctor would have told me. I understand that completely. I had that exact reaction early in my career. But here is what 30 years of opening chests and repairing damaged hearts has taught me. The most powerful interventions are almost never the most complicated ones. The body isn't looking for complexity. It's looking for the right conditions to heal itself. And here is what still genuinely astonishes me, even now after everything I've seen. Every single one of these 5 strategies works through the same fundamental mechanism: reducing inflammation and restoring blood vessel flexibility. That's the whole game. 5 completely different doors, all leading to the same room. The man I told you about at the beginning, the 67-year-old with the concrete arteries, after his surgery, I sat with him and his wife for a long time. We talked about all 5 of these things, every single one. He made every change slowly, carefully, in close conversation with his cardiologist. 6 months later, he walked back into my office for his follow-up. His doctor had reduced him from 4 medications to 2. His inflammatory markers had dropped significantly. His pressure was stable, genuinely, consistently stable, for the first time in years. He looked 10 years younger. He stood up straighter. There was a light in his eyes I hadn't seen when he was on my table. And the first thing he said to me when he walked in was this: "Luisa, why didn't anyone tell me this sooner?" That question stays with me. It's part of why I do this, why I make videos like this one, because the information exists, the research exists, but somewhere between the laboratory and the doctor's office and the patient sitting at their kitchen table, it gets lost. You are sitting at that kitchen table right now, and you have everything you need to start tonight. Not tomorrow, not after your next appointment. Tonight. Let's bring it all together, because I don't want you to leave this video with a list you'll forget by morning. 5 things, 5 changes. One more time, clearly. 1. Eat your vegetables first at every meal, before the bread, before the rice, before anything else. 2. 1 to 2 tablespoons of apple cider vinegar in a full glass of water with each meal. 3. 30 grams of walnuts, about 14 halves, 30 minutes before you go to sleep. 4. 3 cups of hibiscus tea every day, hot or cold, with minimal sugar. 5. Replace your canola and soybean oils with extra virgin olive oil and real butter. 5 things. No exotic supplements, no expensive equipment, nothing that requires a prescription. Now here's what I want you to do right now before you close this video. Pick just one, not all 5, just one. The one that feels most doable for you tonight. Maybe it's vegetables first. Maybe it's ordering some hibiscus tea. Maybe it's walking to that oil cupboard. Just one. Start there. Because sustainable change never comes from doing everything at once and burning out after a week. It comes from one small decision, repeated consistently until it's invisible, until it's simply the way you live. I have seen this work, not in theory, in real people, in their 60s, their 70s, their 80s, who decided that it was not too late to give their body better tools. It is never too late. Your blood vessels are remarkably responsive. Give them the right environment and they will respond. Which of these 5 are you going to try first? Tell me in the comments. I read every single one. And if this video helped you or someone you love, please share it. There are people in your life right now who need exactly this information and have no idea it exists. Subscribe if you haven't yet. Every week I bring you honest, evidence-based information that I wish every one of my patients had access to long before they ever needed surgery. Take care of your heart. It has been working for you every single minute of your life without ever asking for anything in return. It deserves this. One last thing, and this truly matters. Everything I've shared today is general information based on current research and my clinical experience. It is not a replacement for your personal medical care. Please, do not stop or reduce any medication your doctor has prescribed without speaking to them first. Bring this information to your next appointment. Have the conversation. Your doctor is your partner in this. And these 5 strategies work best when they work alongside proper medical supervision.